After covering the laser physics and laser science portion, we're now going to see how the elements that I discussed in the first part of this part of the training are going to be emphasized in using your laser clinically. There are a large number of dentists who will buy the laser, diode lasers in particular, to work as tissue management devices, an alternative to electrosurge. And in buying that alternative to electrosurge, they will buy it for using with their CERECs or using for posterior crown troughing, and that's it. They don't learn to use any of the other procedures. When I was teaching courses at LVI, we found that only 8% of the respondents who came to the course were actually doing soft tissue procedures, things like frenectomies, biopsies. They learned them in school, but as soon as it involved sutures and as soon as it involved a lot of cutting and stitching, many of them said, I think I'm just going to send the biopsies away, I'm just going to send the fibromas, or I'm going to watch those, or yes, you have an aphthous ulcer and you need to get something from the drugstore. But there are a lot of things you can do with the laser that you can learn new techniques, new procedures. It will increase the bottom line, your return on investment can be very great, and it can make some of your cases just a little bit nicer. Things like smile recontouring in combination with veneers, or cases where there's large class 5s and the tissue slumped over top of the carious lesion, to be able to simply remove that tissue very quickly without getting it in the way of the caries, or to be able to do some smile recontouring to even out the heights of the tissue, it just makes that case so much nicer. So if you can learn some of these things to use your laser with, and that is the concept, not only so much the settings, but to give you a concept of what the laser can be used for. If you leave after this section with the concepts of, oh, I can use it for frenectomies, here's how I do it, here's what I can expect the healing to look like, that's what the intention of this particular portion is. I'm going to give you 10 procedures, and the first one that most people buy, and it's very simple, is buy the laser for, is gingivectomies and then gingival troughing. These two are common things that most people will use their lasers for, and I encourage you to start when you use your laser with gingivectomies around posterior class 5s. Something simple where you don't have to worry about a tremendous amount of aesthetic concerns. It's not going to be the patient noticing it. Do your gingival troughing in the posterior. Then you start to go to more advanced procedures, things like frenectomies or laser-assisted periodontal therapy. The diode lasers can be used very effectively to minimize bacteria in the pockets, to do decontamination in the pockets. Aphthous ulcers, herpetic lesions, and denture sore spots, those lesions can be dealt with very quickly, and to reduce the problems to reduce the discomfort with those lesions in 30 to 45 seconds, and particularly if they're dealt with in the first 2 days, you can minimize the discomfort with those quickly, and also perhaps prevent the reoccurrence of those lesions in the same area, particularly when they're aphthous ulcers or herpetic lesions. We'll proceed on towards hemostasis and how to use diode laser for coagulation. Lingual tongue tie, which is again a more difficult procedure, something that you may want to look at when you become more experienced. Hemangioma, I think a diode laser is the simplest thing you can do for hemangioma. There are many women and men who have these lesions on their lips and are very concerned with the purplish color of them, and these can be handled very simply. You can do laser pulp caps. If you have a very small exposure, you can use the diode again to disinfect, to coagulate the area prior to putting your restoration in as a direct pulp cap as opposed to calcium hydroxide. And we'll leave the last one, the ovate Pontic, again to try and create an emergence profile for your Pontic, and I'll talk to you a little bit about that. There are other things like fibromas, which are fairly easy to remove. Those are simple things, and we may cover those, but these are 10 basic procedures that I thought I'd try and start you off with before you get into some more advanced procedures where perhaps you say, maybe I can use the laser for that, but the concepts of some of these simpler procedures will allow you to get to those more advanced things like implant uncovering, perhaps large vestibuloplasties in the addition of dentures, working with dentures. Those kinds of things are perhaps reserved for dentists who've got a little bit of experience using their diode.